Greetings on World Heart Day 2022. All of us know the importance of physical exercise for heart and cardiac health in general. Now, what I would like to share with you today is some basic information regarding exercise that is beneficial for heart health. Let's start from the very beginning. The heart beats approximately 70 to 80 times per minute in every individual. This 70 to 80 times beating of the heart per minute at rest is called the resting heart rate. The resting heart rate in the average individual is approximately 70 to 80 times per minute. Of course, this is not a constant across all age groups. The resting heart rate in athletes is much lower, often in the range of 50s to 60s. The resting heart rate in children, in infants, is much higher, sometimes more than 100. But for the average individual, the resting heart rate is approximately 70 to 80 times per minute. And this is what we will take as the basic guideline for this video. Now, if one wants to keep the heart in good shape, the heart muscles have to be exercised periodically. What is the frequency of exercise that is required? And how much of exercise is required? All these things have been enunciated in fairly great detail by the American Heart Association. What I would like to share today with you is the details of the exercise regimen for cardiac health as prescribed by the American Heart Association. Now, the American Heart Association says that moderate physical activity for 150 minutes per week is sufficient to maintain cardiac health. When you say 150 minutes per week, it approximately amounts to 30 minutes a day for 5 days in a week. So 30 minutes a day, moderate physical activity is what is required for good cardiac health. Now, how much should you strain or how much should you stress the heart for these 30 minutes to ensure good cardiac health? For this, we need to look at two other important numbers. The number one is the peak heart rate. The peak heart rate is the heart rate at which the heart is stressed to the maximum. As one exercises, the muscles need more oxygen, the heart pumps faster and harder. So when the heart pumps faster and harder, the heart rate increases. So the resting heart rate, which we mentioned a few minutes ago, 70 to 80 times per minute, gradually increases with the intensity of exercise to 100, 120, 130, 140, 150, and sometimes even higher. The peak heart rate, the safe peak heart rate varies with age. Now, for a 20-year-old, the safe peak heart rate is calculated as 220 minus the age. So 220 minus age equals 200. So the safe peak heart rate in a 20-year-old is 200 per minute. Now you don't need to reach this 200 per minute for adequate cardiac health. If you reach 70% of this peak heart rate, so in a 20-year-old, the peak heart rate 220 minus age, 70% of 200, that is approximately 140 beats per minute. If you reach 140 beats per minute, and sustain 140 beats per minute for 30 minutes every day, that is enough for a 20-year-old. Going a little further beyond, for a 40-year-old, if you look at the numbers, for a 40-year-old, the safe peak heart rate is calculated as 220 minus 40, that is 180. So the peak heart rate for a 40-year-old is 180 beats per minute. And 70% of 180 is 126 beats per minute. So if a 40-year-old exercises and maintains a heart rate of 126 beats per minute for 30 minutes, that ensures his cardiac health. Let's go a little further. For a 60-year-old, the safe peak heart rate is 220 minus his age, that is 60. That is 160 beats per minute. And 70% of 160 beats per minute is approximately 112 to 115. So if a 60-year-old maintains a heart rate of 112 beats per minute for 30 minutes during exercise, 5 days a week, that is sufficient. So these are the basic principles of calculating how much to stress your heart during exercise to maintain optimum cardiac health. Now, cardiac fitness is different from muscular fitness. Muscular fitness, the principles of tracking how fit you are, how flexible you are completely different from what I have just described. What I have just described is the quantum of exercise needed to ensure that the muscles of the heart are maintained in good physical shape. Now, we have talked about the resting heart rate, we have talked about the peak heart rate, we have talked about 70% of the peak heart rate, we have done some calculations to find out how much a 20-year-old, a 40-year-old and a 60-year-old needs to do to maintain good cardiac health. This is for the average individual. Now, if you want to increase your cardiac fitness further, we talked about maintaining 70% of the peak heart rate for minimum of 30 minutes. That is the minimum. But if you maintain 70% of the peak heart rate for 60 minutes or even 90 minutes, the beneficial effects of the heart are doubled or even quadrupled. So 30 minutes is the minimum. But if you keep that intensity of exercise for 60 or even 90 minutes, that is even more beneficial. Another very beneficial exercise for the heart is called high intensity interval training. I won't go into too much details about this today. There is plenty of information available on the internet. But basically, high intensity interval training is alternating between high intensity training and low intensity training. To give you a very simple example, somebody who runs or literally sprints for approximately 50 meters, then walks for the next 100 meters, then sprints again for 50 meters, then walks again for 100 meters. This is variation in the intensity of exercise, alternating between low and high intensity exercises. High intensity interval training is very, very beneficial for the heart as well. So I hope this information in this video has been useful to you, and you will start exercising for good cardiac health starting from today, World Heart Day 2022. Thank you for your attention.
Mother Care Hospital, providing care with kindness.